Dysmenorrhea. Definition: Dysmenorrhea means cramping pain accompanying the menstruation. Types: primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea refers to one that is not associated with any identifiable pelvic pathology. It is now clear that pathogenesis of the pain is attributed to a biochemical derangement. It affects more than 50% post-pubescent women in the age group of 18 to 25 years with ovulatory cycles. Secondary dysmenorrhea, it refers to the one which is associated with the presence of organic pelvic pathology, that is fibroids, adenomyosis, pelvic inflammatory diseases, and endometriosis. Unilateral dysmenorrhea occurs in a rudimentary horn of a bicornuate uterus. It is also seen in some women wearing intrauterine contraceptive devices and in cases of cervical stenosis. Primary and secondary dysmenorrhea. Differentiating features are onset. Primary dysmenorrhea arises within the 2 years of menarche, whereas secondary arises 20 to 30 years, maybe pre and post menstrual. Description: cramping, hypogastrium, back and inner thighs. Variable dull ache. Symptomatology: in primary dysmenorrhea we can observe nausea, vomiting, diarrhea, headache and fatigue. Whereas in secondary dysmenorrhea there is a dyspareunia, infertility and menstrual disorders. Pelvic findings are normal in case of primary dysmenorrhea, whereas it variable depending on the cause in secondary dysmenorrhea. Etiology is excessive myometrial contraction, ischemia, excessive prostaglandin production. In case of secondary dysmenorrhea, causes are endometriosis, pelvic inflammatory disease, adenomyosis, fibroids, pelvic vein congestion. Management differs in both cases, whereas in primary dysmenorrhea, reassurance, analgesics, NSAIDs, antispasmodics, oral contraceptive pills, in rare cases surgery is indicated, whereas in secondary dysmenorrhea, treatment is directed to the cause. Varieties: dysmenorrhea is described under the 3 clinical varieties: spasmodic dysmenorrhea, congestive dysmenorrhea, membranous dysmenorrhea. Spasmodic dysmenorrhea. It is the most prevalent and manifests as cramping pains, generally most pronounced on the first and second day of menstruation. Congestive dysmenorrhea. It manifests as an increasing pelvic discomfort and pelvic pain in few days before the menses begin. Thereafter, the patient rapidly experiences the relief in the symptoms. This variety is commonly seen in pelvic inflammatory diseases, intrauterine contraceptive device wearers, pelvic endometriosis, and fibroids. It is also experienced by a woman having varicosity of pelvic veins. Membranous dysmenorrhea. It is a special group in which the endometrium is shed as a cast at the time of menstruation. The passage of this cast is accompanied by painful uterine cramps. This is a rare variety. Clinical features are severe incapacitating pain which interferes with a woman's daily activities, increased level of prostaglandins in the menstrual fluid, uterine cramping, nausea and vomiting, backache, diarrhea, giddiness, syncope and fainting. We can see the clinical features in this picture. Investigations are pelvic sonography followed by CT scan or MRI scan if indicated. Diagnostic: hysterosalpingogram, endoscopy. Treatment is medical management to relieve the pain and reduce the symptoms. Analgesics, antispasmodics, prostaglandin synthesis inhibitors, NSAIDs can be advised. Treatment and management includes daily practice of yoga, meditation, and avoiding the junk foods.